So Kenya has approximately 116 psychiatrists, around 30 clinical psychologists, and then fewer than 500 mental health workers, serving population of about 50 million people. And in Kenya, only 16 out of 47 counties that have employed a psychiatrist, that is at the county level. So this information can tell you how mental health is a problem to Kenya, and which also really is not far from other countries of Africa, and even in some countries it is worse than Kenya, which is a middle-income country. We have the countries which have not easily reached that level of being a middle-income country or developing country. We have those many countries in Africa, they range on being a middle-income countries. And what I can say is that comparing as with the global assets, that around 50% of people with mental illness in high-income countries receive some form of care. That is, if you compare it with less than 10% as been in Africa setting. So this gap precisely now tells why there is very much use of AI in Africa. And just to say one of the driver or one of the things that is driving AI use in Africa or even in Kenya, it is that access gap. Not just, you can tell the load of having one person trying to cover up to 100,000 people in terms of meeting their mental health, needs. And that tells you why AI is coming in to really give, for example, in terms of the workload, these clinicians, if, for example, I have a problem and even I don't know where should I go, because most of the people in Africa, they're really also in terms undermanned into the space of mental health. There's a lot of religion in Africa. They'll tell you once you look like your head is not well working, they'll tell you you've either been witched, or probably you are cursed by someone in your family, and they will just go and tell you to really look to other avenues, like going to pastors, being prayed for, going to to those witches, so they can help you, they can give you traditional medicine. So in terms even of assessing mental health in Africa, it has been really an issue. But now with developing technology, with like AI, many young people have really found a place where they can go online and search that information and be able to really know what is affecting them. And I can say that, for example, here in Kenya, that there's recently there's an organization called Kenya Red Cross Pathway Technology, which was launched by Red Cross. It's a chat care, and it's a free mental health chatbot, which was launched by Kenya Red Cross. It's available 24/7 on WhatsApp and also on Telegram, which really offers Kenyans a safe space to talk through anxiety, grief, stress with no appointment required. So just organizations are just trying to see how can we cover this gap. And with this introduction of AI, then can we try and see if it can really support us than having those people out there suffering without having any form of treatment, without having any form of help from mental health practitioners that we have, which are less compared to the population. And there is one thing about mental health, and most of us, mental health is implemented in a pyramid, like the one I know all of us here, we are familiar with the Maslow hierarchy of things, the way it's presented in a pyramid. And in the pyramid of mental health, we have at lower side where we can access basic services, and then we have the middle, we have what we call community and family support, and then we have near the top, we have what we call non-specialized supports, and then at the top of the pyramid, we have what we call specialized services, and these are the services that are offered by professionals. And it is designed like that so that when you have a small issue, in mental health, an issue will start as a small issue, it will become a bigger issue, and then it will become an issue that even the community itself cannot be able. And now these are the cases now which go up to specialized care, and they designed it like that so that when you have a small issue, a mental health issue, at the community level or at the basic level, you can be able to have someone who is guiding you through this before even going to the community level or at the family level. Maybe you have a friend who is aware about this mental health, and then even before the family is able to deal before the issue goes to those non-specialized support, that is the health workers, that is the teachers. Before even it goes there, at the family level or the community level, this issue should have been dealt with. But you find most of the issues are not even being dealt with at the basic level, at the community level, because again, you realize most of the families are either separating because on one thing or the other. And then also we find that people are busy in Africa. You move to many of the countries, parents are not there. You find most of the even the relatives are not there. We are slowly adopting that individuality, like a kind of living, where now children are being left with the teachers, are being left with the house girls who are not able to handle some of these things. And then you find those cases even going to a level of requiring a specialized care, which again we are saying they are not enough. Then also another contributing factor is the mobile applications or the mobile first infrastructure that is really growing in Africa, and it makes that technology. It's making Africa as one of the, for example, we all know about M-Pesa. For those who are from the rest of Africa, there's a platform called M-Pesa where people are able to send money and receive money using mobile phones, and even get SMSs, and this technology is spreading right now. The technology has gone up to Ethiopia, so it tells you this mobile technology of infrastructure that is developing in Africa. Then people are trying to see if they can take advantage of that, just to ensure that they incorporate the AI tools into that. And a very good example here in Kenya, there are some digital health platforms or systems that have been brought forward just to ensure that it supports people with health issues. There is what we call Jacaranda Health. It is in partnership with Google. It's developing an AI-powered handheld ultrasound device for our maternal health. Then we have what we call SophieBot, an AI chatbot used to answer questions about reproductive and sexual health. We have another one called Dam Sasa. Damu means blood, and Sasa means now. It's a cloud-based plant services platform improving emergency response to logistics. And then we have another one in South Africa and Kenya, Nigeria. Like South Africa, Kenya, Nigeria are the leading countries in the sub-Saharan Africa in terms of telemedicine adoption, with AI-enabled chatbots increasingly used for the patient triage. Triage is where you go get treated and go back, and you find in Africa they are really using AI. So instead of you even going to the health facility, you can be able to get the same services online, and even the medicine is able to be brought at your doorstep. Then we have, and I know Priscilla talked very much about the stigma reduction through through AI, because it's an anonymous, that it has a judgment free, and so I will not talk about much about that. And then the other thing is about workforce multiplication, that AI force multiply for an overstressed system. With Africa health workers paradox that I have just painted some minute ago, as shortage on paper, but also high unemployment among trained health workers due to the budget constraint. And I'll give a very good example with myself. I did admired, and I didn't wanted to work.
Sorry to cut you short. I think for the rest of the points, please just mention so that we save on time.
Okay.
We'll have more speakers.
Okay, thank you. So, like I've said, that with unemployment, where we find many health workers have not, you've been trained as a mental health worker, but because of unemployment, you find yourself going to do other works. So then AI driven, that is in terms of chatbots, are coming in to assist. So overall, that is why AI adoption of use of AI is becoming so much in Africa, and those are the points that I am prepared to present. I know there are many other reasons, but that is it. Maybe we can move to the second question, Val.
Yes, because of time, we just going to move very fast. Just finish up, and then Flominah will be coming in to also finish up very fast. So we know that mental health information is highly sensitive.
Yeah.
Should organizations protect patient data when using AI?
Okay. Thank you so much, Val. One of the recommendations that I have in terms of one, it's that privacy by design, built for I'll talk about African context. You find most of the AIs, they have been trained elsewhere. For example, in US, other countries, those developed countries, but you find those AI are very much used in Africa. So one of the recommendations is that we design AI systems that are built according to our context, that covers even our cultural needs, and also the minimize that data being accessed to the outside people. Then the other recommendation is that I'll talk about there's an incident with the MT Pioneer in Kenya, where it was an online platform where Kenyans could get healthcare through the system, but some later after auditing was done, it was noticed that that information was assessed, or it was hacked, or it was shared with outsiders, and out of that, one of the things that we can learn is that we put down policies to ensure that as we take these AI systems into our context or into our country to manage mental health issues, then we are put some some security features to ensure that this information again is not being assessed by outsiders, because if an information goes out there and maybe a member of a family find out, for example, the sister is going through this mental health and he has been doing this and this and this, it will make the situation even worse. Then I'll talk about transparent in terms of context, that is in terms of consent. That is that the practitioners, as they use AI, before even you start taking over a client, can you tell that client, can you explain to that client that you're using this AI, for example, in note taking during counseling sessions, doing this and this and this and this. And then the other thing is that we need to build locally regulatory engagement. That is, it can be for the Africa, or then it can be adopted into at the country level, just to ensure that there is, in terms of regulations, or now people are using AI or AI to assess the information about mental health. And then we also, the other thing that I will say, it's in terms of making sure that clinicians or trained professionals or frontline staff are the line of defense. Because I know there is a question that Priscilla asked them, if we can supplement, or we can use AI as a supplement, or we can use AI as a substitute. For me, I would say it cannot be a substitute, but it can be a supplement, especially when it comes taking note, especially when you are trying to cancel a client and you are also taking note. So you can have an AI platform taking note for you to come and review later. For example, if you are sharing information with the client, you can have AI to help you formulate that information, and also it can help you to send that information to many clients at the same time. But just in conclusion, I want to say that one thing, that every day our patient sits across from us or type into chat box at midnight and share things they have told no one else. The MT Barrick I talked about showed us that very locally exactly what happens when that trust is not matched by the right safeguards. Real people, diagnoses, and ID numbers exposed online. Kenya already has a strong legal foundation, and even other African countries have already has a strong legal foundation in terms of data protection. What we need now is to discipline they actually live up to it. Protecting mental health data is not a compliance checkbox, but it's a price of being allowed to do this work at all. So the conclusion is that even as we use AI, it's not a bad thing, but then we need to put on measures to ensure that, again, we are protecting the same people that we are trying to help. Thank you so much, Val.
Okay, one, I'll tell them that AI can be helpful at a starting point, because I've used it, I've asked it questions. It will give you the information, coping strategies, a space to organize like your thoughts. You'll be able to organize your thoughts. That it gives you the immediate support that you need at that time. However, it cannot replace mental health practitioners because it doesn't have empathy. Sometimes the AI does not take words like you text on any AI, either it's Grok, either it's ChatGPT, and say, I want to kill myself. It will not take up those words. So it will not even give you like an answer. You will not get an answer to that. So it's important, yes, to give you the first help that you need at that moment. That is the immediate support, the first information that you might need at that time. But then it will not give you diagnosis. You might not know how worse you are. So I will emphasize on that. There is an important, as much as you want to use the AI, please make sure you also reach out to a psychologist, counselor, therapist, or anybody that is is a professional trusted health provider. Like it works as a complement, but not as a professional. So that is all I can say for question 1. And then for question 2 is patients should treat AI as a source of general guidance only. That is all it can do. Apparently, when Val sent this to me, I was like, okay, next week we are having a whole meeting with researchers from APHRC. We trying to come up with a mental health, that is an AI mental health screening tool that will complement health. That is, will support the clinician and also will be able to connect mental health patients, mental health seekers with the professionals. So for me, I would say patients should just take AI as a general source guidance rather than like a medical diagnosis tool. So it can help with evidence-based coping strategies, but it cannot diagnose. So we have to understand the difference of those two. That is all I can say. Thank you very much.
When we talk about AI in mental health, I think we also have to be honest about our context. So if I go to my village in Busia, or if I go to Turkana or Tana River, I can't assume everyone has a smartphone or internet bundles or confidence to even use AI. So for me, the question is, how can it's moving from how can the villagers use AI to who already serves those villagers, and how can AI make better? How can AI make them better at what they do? Because now smartphones, most of them are in the city, but my village people, some of them don't even have phones. So for me, I see AI as not a replacement for psychologists or psychiatrists, therapists, but it's something that is going to strengthen the people who are already closest to these communities. For instance, we can take the community health promoters as one example. And Kenya already has thousands of community health promoters. There are people who are trusted, and they always knock on those doors. The families know them by name. They notice who stopped attending church. They even know which child suddenly dropped out of school or who hasn't been at the market for weeks. So we can take an example of a CHP, maybe in Kakamega. These are villages in my country, Kenya. She's visiting a family because a child has missed school for maybe 2 weeks. And during the conversation, maybe the CHP notices that the mother is quietly mentioning that her husband has not been sleeping or has stopped going to the farm or even barely speaks anymore. And she's worried, but she doesn't know if it's something that she should even mention to the health center. And because maybe the CHP is not a psychologist, and in many places, there is not one nearby at all. So we can imagine if she has access to just a simple AI tool that does not diagnose, but instead helps her to recognize, maybe these are signs of depression. And this can lead them to ask even better questions, follow-up questions. How long has this been happening? Has he lost interest in daily activities? Has he spoken about hopelessness? Has he mentioned hurting himself? Because these people, you even mention the word depression, they don't understand what you're saying. And I don't even know how we call depression in Swahili. So we can understand such dynamics that we have. So the AI tool can recommend whether this is someone that urgently needs to be referred. So in this case, we see it has not treated anyone, but has changed the course of that man's direction. And I see this is where AI is making the biggest difference for me. So it's not replacing professionals, but extending the capacity of the people who are already working in these communities. And I see the same even working for support teachers or even youth mentors. As we know, young people, and especially men, I can speak for men, it's not quite often you'll hear them saying, I'm depressed, or I'm going through 1, 2, 3 mental issues, because we keep to ourselves. And now if we take it to the context of the village, they don't know what they're going through. They just say, I'm just feeling tired, or nothing excites me anymore. Or even some don't say anything at all. So you can imagine in the rural schools, some or even many don't have counselors. And sometimes one teacher is responsible for hundreds of learners, and this teacher may not notice that a student is suddenly withdrawing or stopping the participation, or performances dropping dramatically, and they may not know what these signs mean or even how to respond to them. So if a teacher can have such a simple tool that tells them of these warning signs and suggests conversation starters, because also the conversation starters really matter. It can make someone block off completely or even open up. So I see it as a tool that can work even for teachers in the communities to help with the students, the learners that they are mentoring or teaching. So I still see it as it's not coming to replace the relationships, but it's going to strengthen the person who is already having the relationship with the learners. And as someone who works with young people, I see its greatest value, because sometimes all someone needs is one trusted adult to notice that something has changed. And this is where the AI tool can really work well for us. And in rural Kenya, my village, Busia, AI conversation should not just be designed around smartphone in someone's pocket. It should be designed around the trusted people who are already working through this community. Maybe we can focus on them so that the whole community benefits. To your second question on the strategies and policies that we can ensure, the judicious use of AI. Before we even talk about AI policy, we need to talk about trust. And in many communities, people don't first check the emotional struggles to Google or an AI chatbot. I've already mentioned we don't even have access to a phone. And if it's a phone, maybe it's a dumb phone. It's not a smartphone. So they can maybe take them to a teacher or a pastor, a chief, a grandmother, or even a CHP. So if AI ignores those trusted relationships, then it won't succeed. So we need to build AI around existing community systems, not only around technologies. And I see this is one common mistake that even governments and organizations make. They come, they build an app, people download it, those who can, they use it once, then they forget about it. So instead of asking, how do we get AI to every person? Maybe we should ask, how do we get AI into the hands of every frontline worker who already serves hundreds of people in the community? So this means we need to really, really strengthen the community health promoters, strengthen teachers who are still powerful voices in the community, especially rural communities, strengthen nurses, strengthen youth mentors, strengthen even the county health systems, so that if AI quietly makes those people more informed and more confident, then the entire community benefits, because even those who never own smartphone, they'll get to benefit as a result of us strengthening these people who have a relationship with them already. So we know technology alone will not save lives. For instance, a mosquito net only works when communities understand how to use it, they trust it, and they use it correctly. And that's the case I see for AI. If you can empower these, you can call them the access points for the communities. They're already trusted by their communities. So it's going to be easy for whatever information we want passed through AI to even trickle down to people who might not necessarily have access to the AI technology. So yeah, and the other thing which, what's his name? Was it John, the first speaker, mentioned about how training these AI technology. We need to make them understand the Kenyan realities, the Nigerian reality, Tanzanian, different communities' realities, and not just coming with the Western psychology, because we have culture which is different and influences how we behave as a people. So we can imagine if it's asking the generic question to a farmer down there in the village, then we completely miss the point of that AI technology itself. So it really needs to be rooted in the specific community's culture, language, and mannerisms, all these, so that it can work effectively, so that we don't just tick a checkbox, or we created an app, we are using them in the communities. No, we need to see the impact happening in the community, and this will mean that we customize it to understand the specific needs on the ground, and not just from the founders or the makers of the app. Because like he mentioned, people will say they are bewitched, it's just depression. But now if we guide them through all these processes, then they get to understand, hey, you need to take mental breaks. You can't do 1, 2, 3, or this is how you take care of your mental health. So yes, so I don't think there's much. A lot has already been mentioned by the previous speakers. I think I'll take it back to Val.